I'm Mike Cummings. I'm a professor in the Department of Psychiatry and Behavioral Sciences. I also co-lead the tobacco research program at the Hollings Cancer Center. And I'm here today to talk to you about how to quit smoking, because quitting smoking is probably the most important thing you can do to prevent getting cancer, heart disease, COPD, keeping money in your pocket. There are real benefits to quitting smoking. You need to do it now. And I was asked, what's the most effective treatment for quitting smoking? And I have it right here. A garbage can. Throw your cigarettes out. Don't delay. Do it now. There is an urgency to quit smoking. Every puff on a cigarette, 9,000 chemicals, 60 known carcinogens. This is a deadly product. It kills 1 out of 2 long-term users. So the best way to avoid all the health problems that come along with smoking is to stop immediately and get help if you need help. Most smokers that I've dealt with over the years have tried to quit smoking many, many times. Don't be discouraged. A lot of people beat themselves up over the fact that they can't quit smoking. They call it a personality flaw. Well, let me tell you, addiction to Marlboro cigarettes or any other brand of cigarettes out there is an addiction. And the cigarette companies have you hooked, and they engineer their product to make it hard to get off of. You can send them a very simple message: stop buying their cigarettes. Keep the money in your wallet rather than giving it to somebody else. And there are lots of other benefits. I mean, all that money you save, over $1,000 a year, the average smoker will put in their pocket by not, continuing to buy cigarettes day in and day out. Well, most smokers have tried many times, and you do get, quitting fatigue. I understand that. So why do it again? Well, because the consequences of not quitting is that doctor sitting across the desk talking to you, or in the emergency room saying, I'm sorry, I have to tell you, you've just had a heart attack, or you've got lung cancer, and it's because you smoked. And if you've tried to quit before, get some help. Most people, as I said, think it's just a matter of willpower to quit smoking. Nicotine is a powerfully addictive substance. You got hooked when you were a teen. The younger somebody starts smoking, the more likely it is to alter the brain in a way that makes it hard to get off of cigarettes. So don't be ashamed to go talk to your doctor, to ask for some help. They'll be thrilled to help you. There are medications that can help you through the early phases of nicotine withdrawal, the patches, the gum, the lozenge that are out there. These are relatively cheap, certainly cheaper in the long run than continuing to spend your hard-earned money on cigarettes. And the companies, they really don't care. In fact, if you want to know how little they care, the heads of these companies today, the head of Philip Morris, R.J. Reynolds, they don't smoke. So why don't you join them?